Well, good evening again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk to you this afternoon about adult orthodontics. And it's got many problems in it, but you can learn to get around these problems and to do this. Now, I started off at first, had a lot of children, and I did preventive and interceptive orthodontics for quite a while, and then my own patients and everything came in, and I started working on adults and found out there wasn't a lot of difference in there. And I learned that adults' bone structure moves just like anybody else's. It may be a little slower sometimes, but we were able to do adults in just about the same time that we did orthodontics for children and young people. Normally you think about somewhere around 23 or 4 or 5 or 7, somewhere in there. They were saying the bone structure doesn't move, and it does, and couldn't be any less true. I mean, you can move somebody's bone as long as they live, and there's all these things that we changed. A lot of things. You learn to separate the palates on people up into some of them into their 40s, where we could separate it by putting a spring in the front part between the teeth up here and press it on that, plus the expander in the roof of the mouth that you would push against that there, and all sorts of things. Opening the bites, and we just learned a lot of things that could be done but wasn't being done. And to my knowledge today, there's very few orthodontic programs in different universities that teach very much adult orthodontics. And my feeling is really that the university-trained orthodontists should go into adult orthodontics. There's just thousands and thousands of people out there that'll be happy if they know you can do it, and start working on adult orthodontics, and let the pediatric dentists go ahead and treat the kids and right on carry them through. Now, that didn't do much. Most people wanted to get the kids and the easier stuff than all that. But I want you to know you can do adult orthodontics. And our organization, the American Orthodontic Society, was set up really to treat general dentists and pediatric dentist orthodontics. And I feel like that we need somebody in our organization that will go ahead and carry this over into adult stuff. And there's just a world of adult orthodontics out there. And the university people, I feel, should be the ones that really take on the adult orthodontics. And our charging method is ridiculous. I mean, it's like take your car to the mechanic and say, how much do you charge to fix a car? I mean, charge for what different things you're going to do. And in the adult orthodontics, the price could be way, way bigger than it is, and do the different things. There are many people that have the money and want to do this. So anyway, I'm going to hush talking about that and get on to this program. This is an excellent adult orthodontic case here, and so I'll get going here. This is a picture we took after the treatment of the guy, and his deal here, that he looks like he's got plenty of the vertical dimension in here is good. And let me get my little pencil ready here. this vertical height we had to increase a little bit in him. And this is after we finish the case. And I'll show you some more at the end of it, but I don't have the facial pictures here to show you when we started off on this gentleman. Real fine guy. And he's almost 50 years old, and he goes into the 50s before we're through with him, everything. Now here is the way the guy had. I mean, his dental problems had broken down. He's got a closed bite. Man, I mean, you hardly see the bottom teeth underneath here. He's got an overjet and an overbite that's just way too much, you know. And his vertical dimension of this part is closed down, and he's lost posterior teeth back here and over on this side, and he was wearing a kind of an old partial denture. Somebody built a partial that didn't know how to do orthodontics either. So it was what he had. Now, I can't go through these darn cases in 5 minutes and tell you what really happened or how you really do it. And I can't even cover everything in there that I think about, because there are people out there that do all kinds of orthodontics, and you don't want to hear all this beginning stuff. There's people that have no foggy idea about what can be done, and they want to hear it. So I have to kind of get in between that area to give you to cover it. So I have to take a little longer to cover the orthodontic cases. Now he's got this deep bite, and from the side, he's got a tooth back here that's all out. It's leaned way over. He's lost teeth in here. This tooth is drifted in. It may be a wisdom tooth. I don't really know which tooth it is. It'll show up on the x-rays later. Maybe we can tell. And the overjet and overbite, and he has a real closed bite dentally, and he is closed skeletally. So we're going to try to open it. We're going to use these bonded blocks. We've got a deal on them. I just made another one today on that. And now on this part, we're going to have to redo this partial. But I used the partial that the man had to put blocks on top of it. And then I'll have to just show you. Now this is turned. You see this? It's turned like this. The whole shape of the jaw is turned in there. We won't get that completely straightened out, but we'll have some of it. We'll straighten some of it. The lower arch now, we have no molars back here. Now, and then this is out, and this tooth is leaning over. It's going to have to be straightened up in here, and then we'll bring it up and parallel it, and then we'll have him build another partial that will go. So you work with a good restorative dentist, or if you are a good restorative dentist yourself, you can do restorative dentistry with orthodontics and save a whole lot of money and time and mess with doing implants. Nothing against implants, they're excellent if that's all you have. And bridges, they're good too, but if you can do it without them, why not do it without them and use the person's teeth? And that's what we've done in many, many of these adult cases. We bring the wisdom teeth forward and fill up gaps in here on some of these people. But here he has no wisdom teeth at all. All right, here is the partial that this man has. Now it's just a big bar coming across here, and he has a couple of teeth on this side, and he's pushing against this, but this is part of the partial that he has right there. Now we're going to have to utilize that to open the bite where we can get to it. Now you look at the inside of this, and these lower teeth are closing right up almost against the tissue up above, and teeth are out. Now some of you look at this and say, oh my God, what can you do about it? If you get good at doing other orthodontic things, you can do adult orthodontics. And just watch what we do. And I don't want to beat around the bush here, but it'll take me a little while to get through this for you. Now we're going to straighten that tooth. We know how to do that all right. And we're going to put some blocks. We're going to put some blocks on the front teeth and put them together. And then we'll put intruding arches in here and level the bite out. Now this cuspid tooth right here needs to go here. So he's got a class 2 problem, see? So we're going to pull that forward. And I know some of you that are just getting started in orthodontics, leave this time alone. Leave these for people who are really grounded in it and know what to do about it. But it can be done, and that's what I want to stress. And I want the university-trained orthodontics ought to be taught how to do this. And some of them don't even know how to, the teachers don't know how to do it either. Or they can learn how if they need to. So you can take these videos and run them back and forth, and you can see what we actually did here. All right, on the other side, the cuspid, it needs to be in this slot there. This one needs to be here. So it's a kind of a class 2 problem. This was done back when we didn't wear gloves all the time, or when we wore them, then gradually had to do that. Now you can see the roots of these teeth and everything else in here. Now, here is a Panorex, and the guy is 49 and 2 months old. And this was in 11/13 of 90. That's about 30 years. Well, it is 33 years ago. And this is the first Panorex we took on this guy. He's got a root canal, so you're doing that. And it looks like it's bridged across here. And he has, this tooth was back here and it drifted forward. It looks like it was a wisdom tooth. Came up because it's drifted this far. It had to come in place where the 12-year molar was, and the 6-year molars was gone. 6 and 12, and the wisdom teeth are gone over here. Wisdom tooth is out over here, and we've got 2 molars on this side, and the wisdom tooth is gone. So this probably is a wisdom tooth right there. Now the bite I took with a Panorex and let the guy bite all the way together. There's where the lower teeth go to. Here's where the upper teeth go to. So you're going to have to open this and close this down here. And that's going to tend to increase the vertical height of the face. So we'll put a block on these teeth, and if the temporomandibular joints back in here take it, and he doesn't chew with them too hard, he can put that in. These teeth will move together down here, and these teeth we're going to put an intruding arch. You can pull it down and it'll pull these teeth up. Now as it pulls these teeth up, it pushes down on these. As these go down, now you can't get an intruding arch over on this other side very good. Now let's go on to the next picture. Now here we took this little block of acrylic and bonded it to these lower teeth, and had to have it out in front so it contacted his upper teeth. And I think we built some of them up a little bit to fit against that. Now this opens the bite like this. and we're going to try to raise this up as we intrude these teeth in here. Now I can't go through this and just tell you every little thing. It'll take me too long to do it. But now that's that way. We were pulling this back and getting this class 2 relation better. When we freed this up, he moved his jaw forward, and we put a step down arches on this side. Over on this, we just cut this off, and this is his partial, and we built a bonding deal. So we want these to come together, and we want these to go up and bring this down. And this is an intruding arch right here, which goes up, and we don't connect it. It's raising these teeth up. As it picks them up, he doesn't have anything under these. It pushes these teeth down back at the back of the mouth. Now, you're going to have to, if you're a beginner, just forget about this case. But people that are really doing it a long time know something about it. All right, we're going to have this come together. This will go up. We'll straighten this out when we get this going. This go. Now here is he biting into this in the anterior part of the mouth. And when he bites on that, it puts a load on the condyles, and so you have to be careful back there. You'll damage the disc by biting in the front. So he can't chew hard with this. He just has to chew kind of easy. And we've got the intruding arch hooked on these molars, raising these teeth up in this direction. All right, the lower, we've got, this is bonded block in here, and we use that while we bring the upper teeth down in here, and we're going to take these teeth down some, but we'll raise the back teeth up to match the lower teeth. So we're not using the intruding arch, the wire there. And this is the lower, and you have him bite into this. Now when you have somebody bite into something, always put their head in a normal relation and let them just close into that. And that's where they're going to chew all the time. Now this has got an intruding arch on it, and it has the brackets in these other teeth. And here's some of those little plastic wedges where we're turning the teeth around or rotating them. Now that's just a view from the top. Now you remember we had this tooth was up here. It's back there now. We lowered the bite back down here, and the teeth moved forward. We took this archway, went back, and we're straightening this tooth up to some extent here. And we're going to have to make another partial for the guy, or I have a restorative friend that did that. Maybe it was him that sent the guy to me. I don't know. I've forgotten who did it, but somebody sent him to me. The restorative man had done work for me like this before, and this man wanted to help, and so he, as best I remember, that's the way we got the case. All right, so we started out with these teeth down here. These came up some, and we elevated this on this side right here. All right, we're biting down into this point right here. Now we built a bite block that we put in here, and he bites into this. Now that's a kind of like a retainer. I'm going to hurry through this, and this is the old R partial that he had, and here is his supplementary, and we took this when this was when we started out, and we knew I mean, if the man comes and says, if you don't do it, he wasn't going to do anything, and what he had done in there wasn't good at all, and so we are going to change this whole picture of this right here. And you can learn this, and you can do it. and he's 49, he was in the 50s, and here we'll go with the other. Now this is the old partial that we had. Now this film was cut in two. Actually, this fit under these teeth over here and here. And we're going to build a new, or his restorative man built that too. All right, here's starting off. The teeth were here, we moved it here. These teeth were out here, we're going to raise these up, and we'll go down with these a little, up with these back in here, and level this whole thing out. And there it is, after we had pretty well finished it. We've got him in an upper retainer. Its cuspids are going down in here. There's the lower anterior teeth. Here's this tooth that's straightened up, and we put another, made of the, another partial. There's looking at it, the deep bite and everything. That's 90 when it started, and there's when he finished. And there it was when we started. Now look at that cuspid where it changes. Actually, when we got its bite leveled out down here, the bottom of the jaw came forward. It got off the condyle back there, and this looked like this. And that's what was up above to start with, and now we're like that. Now this hasn't straightened all the way, but it was a lot worse. It's coming out this way now. But he wears a retainer. I mean, he religiously, you can see it's sitting in his mouth like that. With it has a bite plate, the retainer's in there, has a bite plate, and he'll have to wear this thing, and then he'll have to wear it at night for several years. This idea of wearing it so much and so little, and all this is just a bunch of bull. I mean, some people need to wear them the rest of their life. Some people don't even need the retainer in there. If the teeth are pushed into place by the forces in the mouth and they're straight, they don't need it. But here he does. And so he's going to have to wear that retainer for a long time. And if we made him look better, it'll push forward in that area. There's 90, and there he is. And we've straightened this out, and we've got another partial. Now here we put a new partial and went around and hooked it in the tree. And this is the teeth on the sides, on the bottom. And that's the way that looks. And here is the gentleman. I think that may have been before we started. I'm not sure. Well, no, that's after we finished it. And there's his smile. I mean, he's got a nice set of teeth, and he may live till he's 95. I don't know. In other words, he might live another 25 years in there, or even more than that. If he's 50 there, he may live another 50 years. And he's got a beautiful set of teeth with a beautiful smile. And you can do this, and their bone will move, and you can do most anything you do on children, on adult people, and they want it done better, and a lot of times you can do it quicker than you can a child. So I'm going to hush up, and I want you to join the American Orthodontic Society. Its headquarters are in Dallas. They have a brand new building starting to join this up, and join the American Orthodontic Society. So I'll see you later. Thank you for watching.